Qualitas Medical Group is a leading primary healthcare provider in the Asia-Pacific region. Founded by Dato Dr. Nurul Amin Muhammad Ishak in 1997 in Malaysia, with the vision of providing quality and affordable primary healthcare services to the community. Qualitas offers a comprehensive range of integrated primary and secondary healthcare, dental and imaging services. With over 20 years track record and supported by more than 1,700 doctors, dentists, radiologists, clinical staffs and personnel, Qualitas has extended its expertise through a wide network of over 300 general practice, dental, medical imaging, and daycare surgery centers across the Asia-Pacific region.
Qualitas is a Malaysian company. We started our operations here. We did take this business into Australia and Singapore, and we have seen great success. Having seen success in these countries, we want to expand into other Asia-Pacific region.
Understanding that each and every life is precious, and that it is our responsibility to do all we can to preserve it in its best possible condition. Patient focus, accountability, quality care and teamwork are the core values of Qualitas Medical Group.
Primary healthcare is a very important component in the delivery of healthcare services anywhere. It is a gatekeeper where the patient comes into contact with the doctor for the first time.
Today, the disease model of the 70s, as stated by the World Health Organization, aging, population growth, the increasing burden of chronic, non-communicable diseases, and multimorbidity, as well as technological advances, are key factors driving the transformation of primary health care. Having demonstrated easy access to quality and cost-effective healthcare and facilities, Qualitas has paved the way to effectively serve the community as a gatekeeper in prevention and management of chronic ailments, the onset of diseases, and to facilitate rehabilitation.
The healthcare sector is evolving, and the primary healthcare services becoming more and more important.
In Qualitas, we believe in providing accessible and affordable quality healthcare services for all, combined with a professionally run healthcare administration and system. Qualitas aims to better the lives of many and to improve their quality of life, with the vision of being the preferred healthcare provider, delivering quality care to the community. Qualitas believes that all the relevant stakeholders within the healthcare industry should work together towards ensuring health and happiness for all. And at the end of the day, nothing pleases us more than seeing the smiles on your faces. Quality healthcare, compassionate services, joyful smiles. Here at Qualitas, we care for your good health.
Saya bekerja sebagai seorang setiausaha di sebuah universiti awam. Kahwin tahun 2000. Selepas 2 tahun tidak memiliki cahaya mata, saya buat check up dekat klinik dan doktor mengesahkan saya ada diabetik masa tu. Keadaan diabetes saya sekarang dah tahap kronik lah, sebab saya dah menjalani proses dialisis, and then mata saya sebelah dah buta. Mata ni tinggal dalam 6%. Mula-mula saya didiagnoskan diabetik tu sebagai seorang yang muda. Masa tu umur saya 26, 7, saya tak boleh terima. Jadi saya ambil masa 10 tahun untuk membiarkan, tidak mengambil ubat, tidak ambil apa-apa rawatan dan sebagainya. Sebab saya sihat, saya seorang yang sangat energetik, saya seorang yang sangat aktif. Jadi saya rasa macam itu saya tak percaya. Saya in denial. Takkanlah orang normal boleh buta. Dia jadi macam tu. Pertama sekali saya kesihankan suami saya. Saya sangat kesihan dia. Dia terpaksa menjaga saya. Dia tak boleh bekerja kerana menjaga saya. Dia terpaksa lepaskan kerjaya yang waktu berjabat dia, sebab dia kena menjaga saya, nak ambil saya pergi dialisis, ambil saya pergi hospital, appointment hospital dan sebagainya. Dia tak boleh bekerja waktu berjabat lah. So dia kena buat kerja-kerja yang dengan yang lain. Sangat kesiankan dia. Marah tidak, kecewa tu sangatlah. Sebab saya banyak lagi benda nak buat. Saya nak tengok anak-anak saudara saya membesar. Saya nak bila anak saudara bila anak saudara saya minta saya mengajar dia, walaupun ABC, saya tak nampak nak tolong dia. Sangat menyedihkan, sangat kecewa. Dan saya sangat rapat dengan anak-anak saudara saya. So bila berlaku macam tu, sangat sedih. Macam itulah. Masa tu kaki bengkak, and then bengkak sangat kat sini ya. Doktor tu check, ingatkan saya untutlah apalah, tapi tak pergi fokus pada pinggang masa tu. And then bila diorang dapat bacaan kreatin, memang terus nak buat dialisis, dan dapat kedai pastilah saya ada masalah buah pinggang. And then kita dalam proses lah untuk buat dialisis dan sebagainya. Dulu saya seorang yang aktif, saya seorang yang yalah kesana kesini, travel dan apa semua. Dan makan pun memang tak kisahlah. Tapi saya dapat diagnose diabetes apa semua tu setelah 10 tahun tu. Dah bila keadaan semakin teruk, baru kontrol lah. Dah tak minum air gas. Bila lepas operation tu, I'm expecting normal view, tapi tidak. Dan doktor cakap, okay, you are not going to have the same view after this. Jadi saya macam redha lah.
Macam sekarang dia dah tak boleh berjalan, dia akan cepat sesak nafas. So saya akan guna wheelchair untuk tolak dia. Most of us, kita cuma tahu kalau diabetik tu potong kaki. Itu yang paling common yang ada lah. Tapi untuk attack ke mata tu, that time kita memang tak tahulah. So
tidak mempedulikannya lah.
Satu tak pedulikan, satu lagi masa tu kita just anggap selagi tak kena kat kaki, it's okay.
Saya pesakit kronik, tapi dialisis tak sakit, kencing manis tak sakit, mata tak nampak tak sakit. So saya tak rasa saya sakit. Dan bila kita rasa tak sakit, kita ignore. That's one thing. Pasal diabetes ni, orang ramai ignore, tiba-tiba kena potong kaki sebab ignore. Sebab tak sakit. Kita ni kalau selagi tak sakit, tak pergi cari doktor, tak pergi makan ubat. Sebab tak aware yang benda tu semakin rosak kat dalam.
Hello. Yes, can anyone hear me yet? Hi. Hi, good evening everyone, and welcome to Qualitas Health Malaysia's Facebook, YouTube and LinkedIn Live to talk about, in conjunction with World Kidney Day, which was celebrated on the 10th of March. Today we have Associate Professor Dr. Ruslinda with us, who will be talking to us regarding diabetes, hypertension and kidney disease, and how are they related, and to create awareness as to why we need to check on our kidneys, and to realize the importance of long-term complications of diabetes and hypertension on our kidneys. Associate Prof. Dr. Ruslinda Mustafa is a specialist in internal medicine and a nephrologist in University Kebangsaan, Malaysia, and she's a consultant nephrologist in Hospital Chancellor Tuanku Muhriz UK Medical Center. Without wasting much time, may I invite Associate Prof. Dr. Ruslinda to speak on her topic.
Hi, Raymond.
Hi, Prof.
Hi. Good evening, everyone. Thank you to all audience for being with us today. I think it's very challenging time to learn about kidney disease at night, but I hope this is going to be very meaningful sessions to you. Allow me to share my screen first. All right. I hope, Raymond, can you see my slides?
Yes, I can. Yes.
Great. Okay. Thank you for your kind introductions. I'm working in Hospital Chancellor Tuanku Muhriz, Ceras, Kuala Lumpur. As we heard just now about the video, the diabetes patient is a very sad story, emotionally painful to the patients. That's why it's very important for us to understand about these three common non-communicable disease: diabetes, hypertension, hyperlipidemia, and their link to the kidney disease. Yeah. So before we move on, maybe as a warm-up, let's have some quiz. 5 questions, very easy. I hope the audience can put in the comment. Yeah? Number 1, doctors specialize in managing patients with kidney disease called A, cardiologist, B, neurologist, and C, nephrologist. Faster, it's very easy. Any answer, Raymond?
You can post the comment. No answers yet. Anyone
no answers yet. Because I think it's too easy. So the answer should be nephrologist. Why I'm being called nephrologist? Yeah, nephrons. Nephron is the main functioning unit of the kidney, the important parts of the kidneys. Yeah? We have roughly 2 kidneys. We have 1 million nephrons. That's why I'm being called nephrologist, the experts in nephrons. Yeah, all right. Next questions. What is the common cause of chronic disease in Malaysia? I think everyone will answer correctly.
Let's give them some time. Yes, they've answered.
Fine, no problem. Go ahead.
Nurul Ashikin has answered C.
C. All right. Any other answer?
Any other answer? We have a few answers coming in. Yes, we have Jared who's answered A. We have Shaza Aziz who has answered A as well.
All right.
We have Lee WS from Facebook who's answered A as well.
Yeah.
A lot of answers coming in A. A lot of them are saying A, diabetes.
Great. Good.
What was your answer, Prof?
Yeah, all correct, but
all correct.
All correct. True. Diabetes, hypertension, painkiller are the causes of chronic kidney disease, but what we are most fearful cause definitely type 2 diabetes mellitus. Yeah, diabetes is our biggest enemy. Yeah, so major problem, right? Okay, third questions. Okay, this is a bit tough. How many stages of chronic kidney disease? 3, 4, or 5?
How many stages of chronic kidney disease?
Yeah, we have stage.
Let's see. I've got Nurul Ashikin saying C, which is 5 stages.
Right. Good.
And then I've got Shaza Aziz saying C, which is also 5.
Right.
I've got, let's see, who else? Everybody's saying C, 5 stages. Yes, all the answers are saying C, 5 stages of chronic kidney disease.
Brilliant. Why I ask these questions, technically, if any of our family members, if we ourselves is CKD, chronic kidney disease patient, it's very important to ask your doctor which stage you are. Yeah, 1 to 5, where you are. Yeah, so it's very important to understand this. Please ask. Yeah, and the first questions. Once you was diagnosed with chronic kidney disease, it is not treatable. Is it true or false?
The answer, Mr. Wentun Jerry from Facebook is saying false.
False. Yeah. So basically, it is treatable. Yeah. Any other answer, Raymond?
They're all saying false. Shaza Aziz is saying true.
Oh, okay.
So maybe we need some enlightenment, Prof.
Yep,
That's why the reason
definitely.
for this. That's why we need this session tonight to enlighten us
Yeah,
on what's the
yeah,
actual, whether is it true or false.
yeah. The answer is false. Yeah, it is treatable. Yeah,
Yes, it
treatable.
is treatable. Great. That's why
All
we are
right.
here.
All right. And the last questions. Yeah, earliest way to detect kidney disease is by urine and blood examinations or tests. Is it true or false?
Let's see. So the answers coming in says Nurul Lee is saying Lee WS is saying A, true. Arvin Lina is saying, let's see. Yep, all the answers are coming in saying A, true. It's treatable.
Great. Great. Okay. It's just a matter of please do it. All right.
Yep.
So, Raymond, allow me to talk on the topic for today. So, by the end
Sure,
of this
Prof.
talk, yeah, I hope the audience will be familiar on what are the kidneys, yeah, and what is chronic kidney disease that I will elaborate further, the risk factors for CKD, the non-communicable diseases in Malaysia, the burden, yeah, how to diagnose CKD, the risk factors, apa pula kena mengenai CKD with diabetes, hypertension, and how to manage. This is a kind of very short sessions. I'm sure there will be more questions come from the audience. All right.
I think very
Okay. Let's.
pertinent questions, I think, Prof. I think
Yeah.
I think they want to understand what is exactly means by CKD, and I
All
think
right.
you
Yeah.
explained it.
I will let them know. Don't worry. All
Yes,
right.
sure, Prof.
So
Thank you very much. Over to you.
yep. This is an awareness program. Tak kenal maka tak cinta. We have to know kidneys first. Yeah, you have to get things right. What is the organs? Yeah, kidneys. Yeah, it's a bean-shaped organ at the back, just underneath your rib cage at the back. Yeah, loin. Your size of a fish. Yeah, kalau badan you besar is bigger. Is your smaller 40 kilos is just the size of your fish. That's how your kidney size. The weight less than 1% of your body weight. But yeah, these two organs so important that it filtered out roughly about 180 liters of fluids every day, 24/7, to produce roughly about 2 liters of urine. You just imagine how important is these organs. Yeah, our kidneys have many functions. The most important to remove all the toxins or harmful waste product from our diet. Not only that, to control our water regulations, acids, alkali, yeah, our blood pressure, the certain hormones that being produced. So kidneys is just a beautiful organ with many functions. When we talk about toxins and kidney failure, we're talking about the major importance functions of the kidney to remove harmful waste products. Understand that. It's just like our whoever stays in KL, DBKL or Alam Flora, whatever you call them. All right. Okay, so what is chronic kidney disease? When we talk about chronic kidney disease, by name itself chronic. Something happened for a long time. It's a gradual loss of kidney function, the functions that I've told you earlier on. Yeah? Remove toxin, control the water, control the blood pressure, control the acid base, yeah? Produce certain hormone. These are the functions that might lose over time. Yeah? If the functions lost more than 3 months, yeah, persistently more than 3 months, 3 months, very important number, 3 months, yeah? So it's called chronic kidney disease. Anything happen within weeks to 3 months, we call that acute kidney injury. For acute kidney injury or acute kidney disease, potentially treatable and reversible. If chronic kidney disease, technically it is not reversible anymore, but it can be treated, something can be done to prevent progressions to kidney failure. So what happened? When they lost all these functions, technically the kidney also very important to filter out certain things. It increase excretions of protein in the urine or small protein, we call it albumin. That's why very important for kidney patients or any patient at risk for kidney disease should check their albumin or protein in the urine. Very simple, just urine test. Yeah. So once the kidney fail over months or years, the waste product can be built up in our body. Unfortunately, the symptoms of chronic kidney disease happen pretty much later at the advanced stage. Yeah, what are the symptoms? Nausea, yeah, vomiting, you lost your appetite, you bengkak kaki, as you see from the initial video, right? And then it started to have other symptoms like high blood pressure, yeah, and blood pressure poorly controlled, feel very tired. These are all the symptoms of kidney disease in advanced stage. All right. So some of our audience answer correctly. There are 5 stages of chronic kidney disease. Stage 1 to stage 5. Stage 5 technically a kidney failure. Stage 4 severe loss. Stage 3 moderate loss, and stage 1 is basically still normal, and stage 2 mild. So can we grade them? How we grade them? I'm going to tell you later. All right, let's move on. So when we talk about kidney disease, we understand about these 5 stages. Technically, I don't want to see you at stage 4, stage 5, because already advanced. If you have risk factors to kidney disease, it should be detected earlier. The earlier, the better. Why? Because if it is found early, we can treat early and we can prevent it from progressing into kidney failure requiring hemodialysis or peritoneal dialysis. Yeah. All right. Let's make things more fearful. Yeah. So we have these 3 common diseases in Malaysia. We call it 3 serangkai. You heard this: diabetes, hypertension, high cholesterol. Yeah. So unfortunately, this based on this survey in 2019, 1.7 millions of adults above 18 years old have these 3 major risk factors for chronic kidney disease: diabetes, hypertension, high cholesterol. And 3.4 millions have 2 of them. So technically, if we as Malaysians fail to tackle, to control these 3 common diseases, then we cannot prevent or stop chronic kidney disease. All right, so that's very important. All right, let's have a guess. Yeah, we are adult Malaysians above 18 years old. Can someone guess? Put it in the chat, put in the comment sections. How many Malaysians in 10 have diabetes? How many Malaysians in 10 have hypertension? And how many Malaysians in 10 have high cholesterol? Just have a guess. I give you a few seconds. Dr. Raymond can tell me.
Let's give them some time. Okay, so
Sure.
I've got an answer from Elaine from Facebook that says 2 in 10 for diabetes, 2 in 10 for hypertension, and 5 in 10 for high cholesterol. Do we have
All
any
right.
other? Do we have any other answers? None so far. I was told that there's a slight delay in the there's a lag. So let's give them a bit of time, 5 seconds maybe. Diabetes 1 in 10, 2 in 10. Let me see if I can answer them. Adult Malaysian 3 in 10, I think, have diabetes.
Anything that we put in 10 is a scary numbers, you know, it's scary
Yeah, I know, it
figures.
is. It is. Okay, we're getting some answers here. Some are saying 3 in 10 for diabetes, 3 in 10 for hypertension, and 2 in 10 for high cholesterol. Some are even going as high as 442. As in,
Yeah.
Lina is saying 4 in 10 for diabetes. 4, that's a lot of people. That's a lot of people. That is 40% of the population.
Yep.
Mr. Lee WS again is saying 677. That would mean 7% of the population have 70% of the population would have high cholesterol and hypertension. That's a
Wow.
very scary number.
That's
Okay,
going to
Prof,
be
maybe you like to enlighten us. What is the actual
sure.
number? And
Sure.
let's take it from there.
Yeah, sure. The numbers that I'm giving is based on the survey in 2019. Yeah? Do remember now we are in 2022, right? The numbers might be higher. I'm afraid not. All right. What happened in 2019 when we did a survey? Some of you answers correctly. 2 in 10 or 1 in 5 have diabetes. So among all the audience, if you calculated now, there are so many of us, I hope not, having diabetes, right?
That's
3
true.
in 10 hypertension, 4 in 10 high cholesterol. Oh my goodness. If we are Malaysians, we should be very shameful of ourselves if this data being presented to the world.
Is
Yeah,
the food, Prof?
unfortunately.
Is the food? Nasi lemak kan ada kolesterol banyak kan? Suka lah nasi lemak tu.
Yeah, I understand. But technically, Malaysia is one of the leading country with the highest diabetes in the world. We should not proud of this. Yeah, we should not. We should be scared of this number. All right, diabetes, hypertension, and cholesterol. Let me make more interesting, Raymond. We
Yeah.
have 1 in 2 obesity.
Oh no.
We are the highest in the world. So, how am I, as nephrologist, going to say that we are going to be successfully retard or prevent chronic kidney disease? I cannot do this alone. I need the help from the community. I need the help from the public to help me to stop chronic kidney disease, right? Okay, now let's have a look. What about chronic kidney disease? Any guess? 1 in? Now I leave it the 10. 1 in? How many have chronic kidney disease? Any answer, Raymond?
Any answers? Any answers? How many people have chronic kidney disease in Malaysia? 1 in? Any answers, anyone? 1 in 10, 1 in 20, 1 in 30? Any answers so far? No answers yet, Prof. But
No answers yet. Maybe it's getting more difficult, or they are scared already to give a
they're
number.
scared to answer. Sorry. Okay, 1 in 15. Cik Syaza
Alright.
Aziz kata 15. 1 in 15.
Okay.
Have chronic kidney disease. 1 in 10 says Jared Ho. Mr. Melvin Van Dot says 1 in 20. Afni Arpin says 1 in 10.
Yeah. All right.
Okay, so
All
it's
right.
around there, between 10 to 20.
Yeah.
So, Prof,
Okay.
enlighten us.
Unfortunately, it's 1 in 6.
Are you
Yeah.
serious?
Am I serious? Raymond,
No
look at
way.
this. In 2018, we come out with National Action Plan for Healthy Kidney because we are scared about the figure. We are putting this National Action Plan. We hope by 2025 something can be seen, but we forget. Unfortunately, in 2019, we have a lockdown and everybody stays at home and eat. All right. So in 2011 survey showed that 9.1% have chronic kidney diseases, and in 2018 roughly about 15.5%, 1 in 6. Come on, guys. Yeah, all the effort that we put, all the awareness program that we put, why these numbers going up is a challenge for us to change ourselves, to change our lifestyle, to ensure this is not going to happen anymore. The numbers should plateau or coming down. Yeah, I challenge everybody. All right. And based on the projections, a survey, studies done, kidney disease is projected to be the 5th leading cause of death by 2040. Please, yeah, don't let this happen. Don't let this happen, guys. Please, we need your help, yeah, to ensure our populations remains healthy. Now, so let's look at this data. Okay, every year, look at this data. Every year we have roughly about 8,000 new patients on dialysis. 8,000 every year new patient will be put on dialysis machines, and at the moment now we have roughly about 45,000, yeah, already on dialysis. You just imagine, it's not only mentally exhausted but physically exhausted, financially also will be exhausted to our community, right? We need to do something, yeah. So I don't want you, as I said, I don't want to see you at stage 4, stage 5. No, I want you to be diagnosed. If you have kidney disease, it should be diagnosed earlier. How? Very simple. Just to remember these 2 things. Check your urine, check your blood. What to be checked from the urine is the albumin. I've mentioned earlier on. Yeah, excess amount of protein in your urine means your kidney not filtering your blood adequately. Simple dipstick, simple test. Yeah. And after that, if you have some protein or you have some blood in the urine, something abnormal, some doctor, they might repeat the test for the second time just to ensure it's a right test, right results, and then they will check blood, check the creatinine. After we check the creatinine, then we can put in the calculator and measure the filtration rate. And which stages you are, 1, 2, 3, 4, or 5. So it's very important. Yeah. All right. These are the stages of chronic kidney disease I mentioned earlier on. 1, 2, 3, 4, and 5. Technically 3 huge. Yeah? So they divided into A and B. Look at this. We start from the bottom one, Raymond. Kidney failure. Whenever the function is less than 15%, technically, this is defined, we prepare you for dialysis. Usually we prepare you physically, mentally for dialysis. Don't ask me, doctor, can my kidney normalize back? Technically, no chance.
Failure,
4
dia dah fail,
also.
gagal
Yeah,
habis.
correct. Stage 4 also. Technically, we prepare you. We try to, delay your initiation of dialysis as long as possible until you are prepared mentally, financially ready. Yeah. Stage 3B, 3, normally 3 is a moderate, mild to moderate. Something can be offered. Yeah. Stage 3 usually we will be referred to nephrologist for us combined care, for us to give you appropriate advice. Yeah. 1 and 2, yeah, still could be under primary care, under GPs, under doctors out there. So these are the most important for any doctors out there also to diagnose, to screen those patients with risk factors for chronic diseases. Yeah, screen. How to screen? Simple: blood and urine. All right. Okay. So what are the risk factors for chronic kidney disease? Again, I mentioned repetitively diabetes. Diabetes. I have to say this multiple times. Diabetes. If you are diabetic patients, if you see a doctor, I would say it's sinful if you did not ask your doctor, how's my kidney? How's my eyes? Yeah, how's my nerves? Yeah, very important because chronic diabetes mellitus is silent disease. It can cause target organ complications, can cause blindness, can cause amputation, can cause nerve damage, can cause kidney failure. You must ask. High blood pressure, obesity, heart disease. If you have family history of diabetes mellitus, we are at risk. You have a kidney stones. If you're taking all the drug over the counter, you're taking unnecessary supplements, unnecessary medications, yeah? or drugs. Yeah? You buy anything from the counter, like painkiller. This all can cause kidney disease, as well as when we're getting older, age above 50 years old. So do remember the top two, diabetes and hypertension. All right, again, similar slides. Diabetes is the leading cause of dialysis among Malaysians. Are we proud of this? If I'm a diabetic, doctors managing diabetic patients, I feel very shameful of myself for allowing my patient to go into kidney failure, for allowing my patient to go through diabetes, eventually develop kidney failure. It's not supposed to be like that. We have to control blood pressure as well. And the rest is other causes of kidney disease, including taking painkiller. All right. So what, doctor? How come diabetes impaired causes due to the kidneys? High blood sugar. Do remember high blood sugar. We ever heard kencing manis, right? Kencing manis, meaning the sugar in the blood filtered through the kidney, come out through the urine. When this process happens, it will cause damage to the filter. Filters means what? The nephrons that I've told you earlier on. The nephrons, we have millions of them, but these nephrons fails. Once the nephron fails, they cannot do their functions, then we develop kidney failure. Kidney disease, as simple as that. All right? What about hypertension? The same process. Yeah, high blood pressure give rise, reduce blood flow to the kidneys, and eventually damage all the blood vessels in the kidneys. Then the kidney fail to functions to remove waste product and extra fluids and other functions as well. Blood pressure will even raise further, and even it's just like a circle. So technically, those with diabetes, those with hypertension need to ensure, if you have, don't feel bad, but need to ensure the disease well controlled. Yeah, it's not a death sentence to have diabetes, hypertension, provided you ensure you go for proper follow-up monitoring, and of course need to ensure within target. All right. So now, how should you manage your risk factors? All right. I'm just give you some tips and advice. Of course, many more that you can ask your doctors. If you are diabetic patients, always ask sugar control. Usually, what the doctors always do, A1C, glycosylated hemoglobin. It's okay if you don't know. Just ask doctor, how's my sugar control? Yeah, doctor always give a numbers, A1C of 6%, 7%, 8%, 9%. Yeah, get to know the numbers. Yeah, blood pressure, control the blood pressure, control your cholesterol. A, B, C. Basically, you just control. Yeah, control. So if you have diabetes, I mentioned this, get it into control. If diabetic patients, technically in general, we do say less than 7% of A1C. Yeah, this is sugar control over 3 months. But of course, doctors will modify the target depending on your comorbidities. If you have many other risk factors such as heart problem, you are elderly, you have a chronic kidney disease, you have a very stroke as well, the doctors might say the best for you 7 to 8%. This is what we call individualized planning. All right, don't make yourself, oh pakcik tu 7%, I want also 7%. No, ask your doctor what should be your target. All right, your target. All right. So what about blood pressure? How should you monitor? Less than 140/90 in general. But certain patients, the doctors will advise for lesser than that, 130/80, especially diabetic patients if they have protein in the urine. Yeah, so that's why it's very important to know your status, whether you have protein or not, whether you have CKD or not, chronic kidney disease. Then the doctor will give you different sets of target for you. All right. How to achieve that? Of course, you have to take medications. There are certain medications that appropriate for certain group of patients. Yeah. So doctor will select accordingly. Yeah. Don't generalize your medication to other patient. That's wrong. If that patient under on A medication, you are supposed to be on D as well. Not necessarily so. Ask your doctors. Yeah. And of course, healthy lifestyle, healthy diet, yeah, limit the salt intake. Raymond, you know what? Malaysian also are champion of taking high salt diet.
Lovely. Lagi sedap lah.
70%
Food is
Malaysian
number
taking.
one. Food is number
What to
one.
do? 70% of Malaysian taking salt more than 2 grams a day. We are champion, but we should be very shameful to ourselves. I understand it's not that easy, but it should start from the family unit. We ourselves, yeah. We have to change our lifestyle, get enough sleep, and usual. All right. What about cholesterol? I think we heard this many times. Exercise, 15-30 minutes every day if possible, 3 times a week if possible. I understand during the COVID pandemic also you have to take care on taking care from contacting coronavirus. Yeah. Cook smartly, steaming, boiling, grilling, baking, less santan. Nasi lemak, try to avoid, Raymond. All right.
Must.
And eat wisely. Increase vegetable from fruits, grains, limit stock. I mentioned this. Okay, I know easy to say, difficult to do, but if we have a correct mind, correct niat, should be okay. All right. Okay. Healthy food choices, simple. Suku separuh. I don't think so. Any Malaysian never heard about this. Suku separuh. What are the separuh things? The vegetables. Yeah. What are the suku? The carbohydrate and also the protein. But just be careful. If patient with advanced kidney disease, stage 4, stage 5, the doctors might advise less fruit intake, fruit that containing high potassium, because that can be dangerous. Yeah. Same goes to the water intake. If you are earlier stage of CKD, if you're healthy populations, we always encourage to take a water intake about 8 glasses a day. It depends on the weather also lah, But if you are advanced CKD, you need to limit your water intake. So technically, not all CKD patients should limit the water intake. You must ask your doctor. I have a patient who asked me, doctor, only stage 3, Raymond, not so much issue. Doktor, saya minum 1 botol kecil je satu hari. I said, why? Because the other patient said so.
No.
Pity this poor guy.
I see.
So it's not necessarily everybody with CKD need to limit water intake. Usually the stage 5 or stage 4, and obviously for those on dialysis. Yeah,
Correct.
Do remember that. All right.
Yes.
Okay, so ladies and gentlemen, the whole audience here, get a check. If you are normal, at least annually. Yeah, at least annually, just have a check. Yeah, if you are those patients with risk, diabetes, hypertension, high cholesterol, even you have heart problem, yeah, at least 3 to 6 monthly. If it's not, provide to you, you ask your doctor, can I have a urine check? Why not? You are diabetic patient. It's always 2 ways of communications. Ask questions. Yeah. And then what about my creatinine? Technically, if you are stable, very early stage of kidney disease, or you don't have kidney disease yet, annually, every year, tak boleh, right, Raymond?
Must. You have to do a medical checkup. That's why Qualitas is there as your primary care to provide. You need to provide, check your blood, check your urine.
Yes.
And go and see the same doctor. Don't doctor shop. because your doctor needs to
Yes.
follow up with you, you know,
Yes.
what is your progress of your indicators and so forth.
Yes.
Yeah.
You know what, Raymond? Some patient blame on COVID. I cannot check because of COVID.
Oh, of course.
So this is not COVID issue anymore. It's our mentality.
Correct.
Yeah? It's our mentality. Takkanlah at just once in a year. Not possible. Get helps. Yeah? Get helps. All right. So, ladies and gentlemen, okay, why we need this to do this? Because the earlier we detect kidney disease, the better that we can do to slow or stop the progression to end-stage kidney failure. All right, that's the end of my my lecture today. I hope I'm more than happy to answer any question later on. Let's go back to the quiz, Raymond. I hope
lovely. Let's
they
do
will
quiz.
answer correctly
And
now.
I think they've been listening. We've got a good audience so far, and I think I think they've been quite attentive. We've got some questions already, and
Yeah.
a lot of them have been liking and sharing the post. Just a reminder: like and share. We'll be having a lucky draw at the end of this session, so increase your chances to be the winner for today's lucky draw. Okay, back to you, Prof.
All right, Raymond, this is not in my slide, but I did mention. So it just to look at whether they are really focused on my on my
Right.
acute kidney injury. I talk a lot about CKD, but now we're talking about acute kidney injury. The kidney disease that happened less than 3 months.
Yeah.
Is an irreversible kidney damage. Is it true or
Jadi
false?
kita boleh repair balik lah. What you're saying is
Ya, boleh
acute
repair
kidney
balik, boleh
injury.
normal. Boleh
Ah,
normal balik.
correct. Is it possible to be normal again? Any
Yep.
answers from the floor? Anyone? Any answers? Acute kidney injury is an irreversible kidney damage. Adriana Greta Gomez has answered false, but Lee WS has said A, true. So we're getting free answers. We're getting A, B mix. Prof, we're getting a mix of answers again. I think you need to speak to them again.
All right. All right. So
Okay, we're
acute.
getting, yeah.
Do you have any more answers?
A few answers, but most of them coming in is B now, false.
B. All right. So I think I need to
I
be
think you
clear
got,
again.
yeah.
This is an acute kidney injury. Acute means it is a reversible.
It is reversible, so it's false.
It
So the
is
answer
reversible.
is false.
It's false.
So the correct answer is false. Yes. So all those who have
Yes.
answered B, congratulations, you got it right. It's a
Yeah.
reversible disease. The idea
Alright.
here is that get checked early, screen early, you can be reversed. Yeah?
Yes.
Okay, over to you,
Yes.
Prof.
Of course, the doctor will find out what is or are the causes of the kidney injury, and we're going to stop
Yes.
according like infection, like COVID infection, stones, they can cause acute kidney injury. Then
Correct.
if we remove all the causes, and then it will repair on its own and is reversible. All right. Second question: symptoms of chronic kidney disease usually occur late at the advanced stage. True or false?
Symptoms of chronic kidney disease usually occur late at the advanced stage.
Nausea, vomiting, leg swelling, tiredness, fatigue, pruritus.
Adriana Greta Gomez has answered B, false. So you're saying symptoms of chronic kidney disease usually occurs early at the advanced stage? No. So the question again is symptoms of chronic kidney disease usually occur late at the advanced. Is it true or false? Okay, we're getting a mixed answers again. B again from Adlina. We're getting A, Miss Nasreen Siddiq, Miss Yana Rahim, Nurazlina Ibnu. Everyone's saying true. More answers are saying true.
Yep.
What's
So
the
as I
answer,
said,
Prof?
as I said earlier on, I did mention tanda-tanda kerosakan buah pinggang berlaku akhir sebab dia silent. Even your earlier video did mention penyakit buah pinggang juga adalah satu penyakit yang senyap. So, tanda-tanda datang lambat. So, you will not know you have kidney problem unless you check. Dr. Raymond mentioned multiple times, we need to check or else we don't know. The moment you have leg swelling, the moment you have vomiting, nauseous, headache, itchiness is late already. Yeah?
So take home message again, guys, is that it is a silent killer, isn't that, Prof?
Yeah,
right?
correct.
You will not know till later. So what they're saying, check. We've
Right.
got various forms of checking. Simple, just sample urine je. 15 ml je, hantar kepada doktor, doktor akan masuk straight and he will tell you whether ada apa pundi kencing bocor. Is that, Prof, you're saying yesterday?
Yeah, yes,
Are
protein
we
leak,
having
protein
protein
leak.
leak? Not is there any protein leak? So the answer is true. All right, because it's a silent killer, you only notice it late stage, too late already. So better to go and screen and know early. All right, back to you,
Right.
Prof.
All right. The third questions, chronic kidney disease is defined, the definition ni macam mengajar student medical as kidney damage that occurred more than how many months? 1, 3 or 6. I mentioned this multiple times. Bermaksud kalau kita ada rosak buah pinggang, kita baru tahu bulan ni bulan 3 belum bulan 6. Tapi kita tak ada risk factor, kita tak ada diabetes, tak ada hypertension, tiba-tiba dah terasa rosak. So adakah ini didefinisikan sebagai kronik atau belum?
So we've got one answer says B, 3 months.
Correct.
The
Alright.
answer is correct. Yeah, that's great. So it's 3 months. Chronic kidney disease is defined as kidney damage that occurs more than 3 months. That means consecutively there is chronic kidney damage, and yes, 3 months. Correct, Mr. Arvind
Correct.
Lina.
Yeah.
Yep.
That's mean, ladies and gentlemen, audience out there, we need follow up. If you are being told to have protein, you have been told that your creatinine abnormal, don't stop there, you know. You need a sequential test and follow up. All right. Let me
Yes,
tell you a
so
story,
important.
Raymond. This morning, I just saw a patient on dialysis already. On dialysis, no? So meaning stage
On
5.
dialysis. Oh,
On
really?
dialysis. And this patient asked me one question. Doktor, buah pinggang saya boleh baik tak? I was like, okay, what went wrong? This is my question to me lah, you know. What went wrong? What from where this patient hears news or information that it can be normalized unless you go for transplant, yeah. So we need to know the moment you are being diagnosed to have chronic kidney disease. Technically, this is irreversible, yeah. But what we're going to do is to prepare you mentally, physically, and ensure the other complication being treated very well. All right. Okay. The answer here 3 months. All right. The fourth questions. All patients with chronic kidney disease should limit their water intake. True or false? So means you are stage 1 ke, 2 ke, 3 ke, semua kena jagai. Maknanya kena
Is
kawal,
the answer
control.
true or false? All patients with chronic kidney disease should limit their water intake. Mr. Melvin Vendot says false. Who else? Everyone is saying, yeah, we're getting, they listen to you, Prof. We're getting
Okay,
an
thank
answers
you.
of these. And yes, it's false. Not all patients should limit. Yeah, Prof, correct?
All right. Thank you. I'm happy. All right.
Yep.
So the last ones, assessments of kidney functions called glomerular filtration rate. Nak tahu yang tahap tadi lah, stage 1 to 5 tadi, is a measurement derived from creatinine in your blood. Betul atau salah?
Is that true or false?
Yep. Maksudnya
Assessment of kidney function is called glomerular filtrate GFR, a measurement derived from creatinine level in the blood. Any answer? Miss Yana Rahim says A. Adlina is saying A as well. True, they're agreeing with you.
Good. So Raymond,
Yep.
basically some lab, they come up with creatinine and GFR straight away. So
Correct.
look at the report, but some lab, they do not have this GFR. The doctors need
Yes,
to calculate. They put
The
into the
normal
system.
renal profile, Prof, does not indicate the GFR. The standard
Yes.
renal profile, just urea, creatinine, and
Potassium,
right?
sodium. Yeah,
Sodium.
okay.
You do not mention
So,
the GFR, correct?
correct. So any patients with risk, diabetes, you're obese, you're hypertension, you have, or if the doctors mention your creatinine, get to know the number of the creatinine, ask them, tahap berapa doktor? So the doctor will put it into calculator and it will come out as which stage you are. Stage 5 basically that's 15 to 29, stage 4, 30 to 60, stage 3, 60 to 90, stage 2, more than 90, stage 1. All right. So what I try to say to you, to empower our knowledge, our understanding and our awareness of kidney disease, we must understand what are the risk factors for kidney disease, understand, and we will take care of ourselves. You must remember that kidney disease is a silent killer. Raymond did mention that it's a silent
Yes.
killer. Yeah, signs and symptoms occur late. The most important is the screening test. This screening test, Raymond, is a vital,
It's
you
so
know. It's not.
important. So important.
Yeah,
Prevention
so
is better than
important.
cure. Prevention is better than
Yes,
cure. So
right.
early
It's so
detection is the
vital.
most important. Yes.
All right, great. I stop sharing now.
Okay. So, Prof, we've got some questions already prepared for you. I think it has been a very interactive session. I think you've got the attention of most of them who have joined us from earlier on. We thank you all again for participating in tonight's uh, session, where Prof is enlightening us on chronic kidney disease in conjunction with World Kidney Day, or celebrated on 10th of March. We have Miss Zaidatul Aima from Facebook who has a question. She's actually asking, any news on future treatment of diabetes and CKD?
Oh, banyak Zaidatul. Yeah. So technically, the future treatment of diabetes in Malaysia is very bright to me. Very bright. There are many options, and of course, we have newer type of anti-diabetic medications nowadays in the market that also can protect the kidney. Not only that, also protect the heart. So go and find these medications. Yeah, there are so many types. So if you are diabetic patients, you are not you know your medication, you ask your doctor, doctor, is there anything else that you can offer me to help me getting CKD or also from getting heart problem. All right.
Yes.
The newer medication, we call them glucose SGLT2 inhibitor, sodium glucose transporter inhibitor. Yeah. I hope this is a new type of medications only available 2015 onwards. You can ask your doctor whether you are suitable or not. And let me tell you that not everybody is suitable for these medications. All right, that's why I cannot say everybody should get it, but of course you need to ask your doctor. Yeah, your treating doctor. Yeah.
I think the most important thing is to get checked and find out if you have diabetes. I think most of us here are relatively young and we are not in that stage, but we will have parents. We'll have parents, we have uncles, we have aunties. I think the most important thing is to create awareness that we need to identify, because we know as Malaysians we have a sweet tooth. Kita suka makan banyak, ada banyak pilihan makan-makan. There's a lot of choices of food. I think it's important while we enjoy the food, we also need to do regular medical checks to prevent us from getting illness and from getting CKD. All right, as much as there's treatments for it, let's prevent us from falling into that trap. Yeah,
That's the whole idea. Don't ask me about treatment for CKD. Prevent. I want to prevent.
prevent it. Okay,
SGLT2, GLP-1, there are so many out there. All right.
we have one question from Cik Nuhayati from Facebook. Are my children at risk of diabetes or CKD if I have it?
The answer is absolutely. Yeah.
Yes.
So diabetes runs in the family. That's why I always, when I see patient in clinic, yeah, the short answer is yes. Let me tell you a story. If I see a patient in clinic, CKD due to diabetes, yeah, Raymond, and I saw this patient came in with two children, both obese, I will take the opportunity telling them, both of them, look here, your mom having diabetes, your mom having CKD, you are not yet, right? And then he said, am I? They are not sure whether they are diabetic or not. So they should check first. All right. Then, of course, if they don't have diabetes, I've told them, please take care your weight and your diet, your lifestyle. This is opportunity to me to advise these two, anak-anak dia lah, you know. So give them awareness instantly when I saw them in the clinic. So the short answer to this, yes. If you have diabetes, please ensure your lifestyle change among your family members. Yeah, among your family members.
There is a genetic disposition. If your family members, your mother and your dad are diabetes, the chances of you becoming diabetes is already high being Malaysian. You're extra increased by just having genetic disposition.
Yeah.
So the important thing is to create awareness, screen, check, and prevent. Yeah. So change your lifestyle, change your diet accordingly, so that you can prevent getting diabetes. And by preventing getting diabetes and hypertension, you prevent getting chronic kidney disease. So see your doctor, get your doctor to counsel you, and do regular medical checkups. Prof, we have another question. I think this you answered earlier, but let me just go through quickly. Can someone have very serious CKD even without any sign or symptoms of any disease?
Yes.
Yes,
That's the
correct.
problem. That's why Raymond mentioned to us, check. Okay. In general, most patients will have symptoms, but some patients. I just have a patient a couple of weeks ago, young, 36 years old, no diseases, as mentioned here, not known to have any disease, not known, technically not known. So what happened? He came in with nausea, vomiting, kaki bengkak. This is symptoms. But we have a patient too that come for pre-employment check. Yeah, pre-employment, no symptoms, no known problem, but because pre-employment, they requested to check blood or pre-employment of insurance requirement, then
Yeah.
noted, found out to have creatinine of 500. The patient just in shock. How come, doctor? I don't believe this because I don't have any symptom. That's possible too. So when we check, we found out that this patient actually already got a single, satu je buah pinggang dia, born with one kidney.
Correct.
Yeah. So
Very
some
important.
other, and some of this patient did not control the diet, being obese or whatnot. So that one kidney failed. So now being diagnosed to have chronic kidney disease. So the gist of the discussions today, have your blood and urine checked. As simple as that.
Yes, so that as you can take home message, get yourself checked. If you look at the link below on your Facebook, LinkedIn, or YouTube post, you can sign up and register for free a test at any of our Qualitas clinics. Just click which clinics you like to go to. We have participating clinics in Klang Valley, North and South. But the important thing, guys, is to go and get checked and find out your state. How many of you, can I ask you a question, just to think, how many of you have you passed urine and you have seen, when you go to public toilets, you've seen all the all these bubbles in the urine? What do you think that is? Prof, would you like to comment on that? Bubbles
Yeah.
in the urine.
Yes, Raymond. Bubble in the urine. Not all CKD patients have bubble in the urine. So
Correct.
if you have bubble in the, like betul-betul macam teh tarik, Raymond, like teh tarik, the bubble up there too. That's really like that. So technically, those who pass urine in the toilet bowl, then they can see the bubble. Those who direct one, they can't see the bubble. All right. So when there is a bubble in the urine, means the protein in your urine is very heavy. Technically, very badly damaged kidneys. Yeah.
That is
Some
not a good
patients,
indication, yeah, guys. So if you pass
not a good at
urine
all.
and you got bubbles in your urine, please go get checked. All right, please get it checked, and so that, because bubbles should not be in your urine. Okay.
Sometimes they don't have protein, but they do not have bubble. That's why they still have to check the urine.
Of course, yes. One more question, Prof. It's from Shaza Aziz. If I'm diagnosed as a diabetic person, will the medication I am on for life or lifestyle changes are sufficient?
Right. Very good questions. In the past, we always think that diabetes is not curable. Yeah. But nowadays, diabetes is lifestyle disease. If you are obese, you have very bad lifestyle, you change that. You have to, and maybe in the first phase, you need to be on medications. Yeah. Because if your A1C, I mentioned, very high, we need to control because we don't want complication. But at the same time, concurrently, parallel approach, you have to control your diet, you control your weight, and then automatically your pancreas function will be better. Your diabetes potentially can be cured. Yeah, have hope, have some hope. That also depends on which type of diabetes you are lah. If you are type 1, definitely cannot lah because not enough insulin in your body. But if this is purely type 2, yeah, and it's purely because of obesity, lifestyle, you change that one, it can be curable. But if you need to be on medication, please trust your doctor, be on medication first and change your lifestyle. All right?
Lifestyle is very important. Medicines can only help. Lifestyle to gaya hidup. So gaya tu kita pilih lah gaya. So we have to choose our style of life.
Not
And
nasi lemak.
not nasi lemak, yeah, but it's sedap lah too. But everything in moderation lah. Guys, let's do
Yeah.
everything in moderation and do that correctly. One more question, Prof. We have a lot of questions actually coming in. Hi, Prof. What's the type of supplements that affect kidney health?
All right, there are many types of supplements out there. There are some supplements definitely advised by the doctors. Means you are lacking, you are known to be lacking of certain nutrients in your body, then you need like iron. Iron is also supplement, right? If you are truly a patient with iron anemia, not enough iron in the body. So doctor will give you supplements. Like pregnant mother, they need to be on supplement of iron folic acid. Yeah. All right. Some patients while they are taking iron, they need to be on vitamin C. That's so-called a necessary supplements. Yeah. Some patients they are on certain medication. They need to protect the bone. So they need to be on vitamin D supplement. There are certain patients on osteoporosis, but this basically the supplement that being advised by the healthcare doctors. My concern, supplement that you people out there recommend to you, and this is not the doctors, not the healthcare professional. Like, for example, I think the paling famous vitamin C, lah Raymond kan?
Yes,
Vitamin
correct.
C, 1,000 a day. So we must understand our body, our God already give us a KPI that vitamin C needed in our body roughly about 96 milligram per day. That's
Are you
requirement. If
serious?
your health,
Really?
only 96.
But
Only
everyone
96.
advocates high, redoxon 1000 milligram satu hari, dia orang,
So,
with
okay, so what will happen? Your kidney will sense that you swallow 1,000, the kidney will remove the 906 lah.
really?
Pity the
Okay.
kidney.
Yes,
Just
yes,
imagine,
yes.
too many things to do. Dah lah tadi nak control air, nak jaga blood pressure, you makan tak tentu pasal pula. Then the kidney have to do a lot more job to do. So, if you're unwell, let's say Raymond, I'm having flu. Yeah, I'm a bit unwell, flu, runny nose, blah, blah, blah. I can take maybe about more, 500 to 1,000 for that particular illness.
Correct.
That 1 week perhaps, after you're getting better, you are healthier, you don't have to.
So
Because
this
you
is
must
good
understand,
information, Prof. So you're saying on a regular day, on a regular dosage of vitamin C, what would be your recommended daily requirement for vitamin C?
100, because that's what is available lah. But if you are eating from fruits, you don't have to. Kalau daripada telan pil, baik I makan jambu batu, lagi sedap, right?
So interesting.
That better
So
I cut an orange.
even painkillers, right, Prof? I think I had a patient
Yes.
when I was running in working in Sabah. I had a patient who took a lot of painkillers during his younger days so he can tahan lama and main badminton. But eventually his kidneys packed up because he used to take constant, like almost so regularly.
Yeah.
Eventually his kidneys packed up and he was on dialysis.
Yeah, but
sedih lah.
painkiller is not falls under supplements lah. Painkiller
Yeah.
is basically over the counter medications, right? So
Yeah.
technically all is correct. If you're taking any things on your own effort, so I would encourage you to get your kidney health
Get
checked.
your kidneys checked.
As simple
Yes.
as that. Yeah,
That's
as simple
very
as that.
important. Okay, we have one more question from Anusha on YouTube. She says, with family history, can someone as young as less than 30 years old have CKD?
Can. Just now I talked about diabetes,
Yes,
hypertension. This is a different sets of populations. If you are young, you might have CKD because you have polycystic kidney. Means you are born with a lot of cysts in your kidney. All right. You might have what we call as inflamed kidneys because of we call glomerulonephritis, inflamed kidney like SLE, IgA nephropathy. This is all autoimmune diseases. These autoimmunes commonly happen in younger populations. Younger, not so much so in diabetes or hypertension lah, right?
Yeah.
But as a cause of CKD, if you are young, the doctor said to you, you have kidney problem. Usually, it's because of disease in the kidney itself rather than disease from other part of the organ. Yeah.
Okay.
Correct.
All right, Prof, how old is your youngest CKD patient and his or his stage?
Because I'm adult nephrologist, 12 years old.
12
I just
years
saw
old.
him. I just saw him yesterday.
Chronic kidney disease?
Yep.
Ini ADPKD ke apa?
Bukan. So dia ada radang buah pinggang. So when a young patient came in with radang, what happened to this boy? He had this bubble in the urine. He started to have headache, high blood pressure lah, yeah? Came to emergency department for high blood pressure for 12-year-old boy and noted to have high blood pressure, and then we checked the creatinine 153. When we calculated the eGFR, already stage 3. Yeah? So what we have to do, we biopsied the kidney, we found out that he has some radang buah pinggang in general term. Then we started managing him. I've told the mother yesterday extensively, it's very hard, this boy don't understand anything, we have to really prime the parents. Yeah? So the directions, what is our target, why we want to do such management is need to discuss in length with the family members. So technically, yes, because I'm adult nephrologist, I'm sure even as young as 6 months old, 3 months old also can have kidney problem. This is under pediatric. So for me, I have as young as 12 years old.
Right. Okay, I think so. Some questions quite general, but I think we just go through it first. What causes CKD?
Oh, so many.
So
So
many.
as I mentioned, so many. You just throw it from your mind is correct. Diabetes, hypertension, obesity, stones, yeah, infections, ongoing
Drugs.
infection, recurring, yeah, anything. You just throw it correct.
Anything. So basically, just put it in summary, our kidneys is like our filter in our body, and so if you damage it with things that are not good, diabetes, if it's too sweet, it will cause your filters to break up, and your protein will leak through, and your blood glucose will go high and goes into your urine. That's why you have kencing manis. So the concept, guys, is that we have to live healthy lives. We have got to prevention is better than cure. But before you can prevent, you need to know your status. And that is why today we are giving you this talk to create awareness. I think there's been so much of good information by Prof. Even I didn't know 1,000 milligrams of vitamin C, because now during COVID, everyone says take vitamin C, 1,000 milligrams, 1,000 milligrams. All the pharmacies are selling out vitamin C, vitamin D in high doses, you know. But yes,
You
it's
better check. You
and
better check.
the test that we're offering is the free micro test. Micro test is basically a short form for microalbuminuria, right? Microalbumin test. We want to test albumin, which is a protein, microalbumin. So there's a specific test that is being offered at all Qualitas clinics. So click on the link below, register and sign up. Our team will get back to you and tell you which clinic you can go to. There's a lucky draw happening after this. Qualitas offers comprehensive medical checkups with renal profile, your GFR, your creatinine, your HbA1c, your sugars, your blood pressure. Get checked, guys. Go to see a doctor, get yourself checked, and find out what is your health status so you can plan for the future. Okay, let's see if there's any more questions. There's one question here. How do you manage hypertension?
How do I manage hypertension in CKD? All right, very good question. So hypertension should be managed as usual, but in CKD patient, there are certain drug we prefer, like ACE inhibitor, that group, or angiotensin receptor blocker, because these medications not only treat hypertension but also can protect the kidney. Technically, the whole idea is to get the right the right medications, and to achieve into target. Target less than 130/80, or depends on your protein in the urine. If you have a lot of protein, then less than 130/80. All right. In general, 140/90. All right. So in Malaysia, another thing, Raymond, in Malaysia, 70% of Malaysians need 3 or more types of blood pressure medication to achieve control. Yep.
Right. Yes, that's
Not only
scary.
one.
That's very scary, you know. I
Yeah.
think in
Not only
working in the
one.
district, you know, we used to add on satu, dua, tiga, empat. You now lose count. Which more groups of hypertensive medication to give the patient? BP still very high, you know, very very high.
Yeah.
Yes, so I think as you mentioned, prevention is better than cure. I think it's important for us to know. So please get checked. Someone asked, Doctor, is drinking cinnamon, is it okay for the kidney? Cinnamon,
If
huh?
you no, okay for the kidney, there's no data, there's no proof. If you taste good for you, go ahead lah.
Right, right,
So
right,
yeah,
right.
yeah. I mean, this is certain thing. Better you put in your cook, right? Cinnamon, bake a bread, in cinnamon. Okay, but it's not for kidney. The intention must be right. Yeah. If you cook it for your meal, go ahead. No, it's not. I don't think so. It's harmful. It's not beneficial as well. But it tastes good.
Okay, I think we've come. I think that's the last questions. Last questions for today, Prof. Thank you so much. Is there anything parting words that you like to share with us, Prof?
All right. The most important, I've seen so many kidney failure patients crying to me, asking for help. So I always tell my patients, look here, I hope I have a time machine to return you back to 20, 30 years back. I do not have that. If your kidney disease because diabetes, hypertension, technically you have to accept. But for the public out there, I encourage you to get to know yourself, get yourself checked, make sure that you don't have a chronic disease, because the moment you are end stage, I do not have time machines to return to you back into your earlier diabetes stage, earlier hypertensive state, earlier bad attitude, bad lifestyle. I don't have that. All right. So please check your urine and your bloods.
Thank you, Prof. So thank you very much for being a very actively participating in today's session. We look forward to having more sessions. Qualitas Medical Group is present all across Malaysia, from Perlis right up to Johor. We have 100 over clinics. We have many doctors who are well trained to look and guide you according to your health. Feel free to catch up and put in any requests, any inquiries that you want on our Facebook page or Messenger, and we'll get back to you. Thank you very much. There's a micro test. Click on the link to receive. All those who have signed up for today's session, you're eligible for a free micro test at any of our Qualitas clinics. After this, we'll be having a lucky draw. We have 3 winners. So if you all have liked, shared the hashtag and share it with your friends, 3 winners will be picked. The winners will be winning a free $150 worth of a medical checkup, including blood investigations at a Qualitas clinic near you. 3 winners will be selected randomly. Let's have the names up. Are the names ready? Or the draw is going on right now? Okay, let's wait. So Qualitas Clinics does medical checkups, and you can get your medical checkup. You can see your doctor, and the doctor will guide you as to what you need. An ECG, you can check for your heart, you can check blood pressure. Yep, how many entries do we have? We have 11 entries. Great. And let's do a draw. And who do we have? Winner, Mr. Nazrul Kisham from Facebook. Congratulations, Nazrul. You have a medical checkup worth 150 ringgit free. Our Qualitas team will be getting in contact with you or giving you a voucher for any of our Qualitas clinics near you. Thank you, Mr. Nazrul. Can we have the draw again for the second winner? Jin Lim from Facebook. Thank you so much. Congratulations. You have just won yourself a free medical checkup at Qualitas worth 150 ringgit. Thank you so much, Jin Lim, for participating. Let's have the last draw. Mr. Fu Xian, congratulations. Congratulations. On behalf of Qualitas Medical Group, we thank you for participating and listening to today's session. We're pleased to give you a medical checkup worth 150 ringgit at any one of our Qualitas clinics. We will be in touch, Mr. Fu Xian. Thank you very much. All right. Thank you all so much. Thank you, Prof. I think we have crossed the time. I think we're already 15 minutes over time. Thank you all so much. And till we see each other again.
Bye-bye.
Bye.
Bye.